This video is optimizing settings for airway pressure release ventilation and optimizing settings to decrease PaCO2. So this is assessing the expiratory flow. So here's my flow waveform here in purple, and I want to assess the expiratory portion of the flow. And I want to assess the peak termination point, and it should be approximately 50 to 75%, which it is, of the peak expiratory flow. However, if the oxygenation status is stable, I can consider what I can do is increasing my T-low at half to 0.1 second increments to obtain a termination point equal to 50%. So all that means is that I'm increasing my T-low, and then it's going to allow for more time for exhalation. So I'm going to go under my settings, I'm going to go to my T-low, and I'm going to increase this at 0.05 to 0.1 second increments at a time. And I'm going to choose to do 0.1 increments at a time. So there we go. We went from 0.2 to 0.3. And let's reassess the waveforms. So here's my expiratory flow waveform pattern. And we'll see that really didn't do much, so I can lengthen it out to, at max, a termination point up to 50%. So let's lengthen it a little more. I'm going to increase that T-low again by 0.1 seconds, and let's put it at 0.4, and look at my waveforms again. And then we're approximately around 50%. I could do this, as mentioned before in other videos, to precisely measure my termination point to make sure it is at 50%. But I'm just eyeballing it now. It looks good. So this is one way to decrease CO2, and that's by changing my T-low setting to allow for more exhalation during this period.